Hello, my name is Dr. Jason with Carolina Value Pet Care. And today I want to talk to you a little bit about different things that we can do after we first get a kitten. So, first things first, congratulations. It's tons of fun when you get yourself that first little new kitten. They're running around crazy, but they are so darn cute. So, congratulations. Now, I just want to making sure we're doing everything we can to keep them nice and happy and healthy as they start growing a little bit older. So one of the first questions I get is, how old should they be when the first time I bring them into the vet? We typically say about 6 to 8 weeks of age is going to be a good time. So 6 to 8 weeks of age, they should be weaned off of mom. They're eating on their own. They're no longer nursing. They're using the litter box. This is an age we want to start getting their immune system kind of primed to start working on its own and to making sure we take care of some other things. So on that first visit, a lot of times what we're going to do is give you a little deworming medication. So a lot of kittens are actually born with worms from their mom. So the mom kind of has them laying in her system, and when they're all stressed out during the pregnancy and actually giving birth, some of those worms or the immature ones can actually pass directly to the kitten, either through the milk of mom or directly to the fetus. So we give them a deworming medication when they first come in. And then also, we're going to start them on their first vaccine as well. The first one we use is called the FVRCP. So it's kind of a combination. Those little initials, each one is for a different virus that we're helping to protect against. Sometimes you'll hear it called just the feline distemper vaccine. So it's feline viral rhinotracheitis. So this kind of upper respiratory, gunky, sneezing, eye gunk stuff that they can get. The other one is calicivirus, also another upper respiratory tract infection. And the P in FERCP is for panleukopenia, which is very similar to the parvovirus in puppies, if you've ever heard of that one before. So it can cause really bad GI issues and those issues with them. So that's going to be our first vaccine, that FERCP, feline distemper one. They get a deworming medication. Another vaccine we think about that they'll get is going to be a rabies vaccine. We typically don't start the rabies vaccine until 12 to 14 weeks of age. So that first visit, they're probably going to be a little bit too young to get it. But it is something that is mandatory by kind of state and federal law that all of our dogs and cats are vaccinated for rabies, just to keep them safe and to keep people safe as well, because there is no treatment for rabies virus, unfortunately, in people or our animals. So we're making sure we keep everybody as safe as possible. So you got rabies around 12 weeks of age, or FERCP at the first visit at 6 to 8 weeks of age. There's another one that I recommend in all kittens and then in adult animals that I know that are going to be outdoors. It's called the feline leukemia vaccine. Feline leukemia, if you ever heard of leukemia in people, it's a immune cell or this white blood cell type of cancer that can develop. And we know this virus actually makes it more likely for these cancers to occur in cats. And it's way more beneficial to get this vaccine as a kitten than it is starting later on in life. So we like to give it to all kittens when they first come in. And we can start that one as young as that kind of 8 weeks or 12 weeks of age, kind of sitting where they're at that point. So we can give them their first booster. They would get one more booster 3 to 4 weeks later, and then that would be good for the year. So we'll do that. That FERCP one, the feline distemper, that one we're boostering it once a month until they're 16 weeks old, or right about 4 months of age. So if you're thinking about it, when they're 2 months of age, they're going to be coming kind of once a month until they're more like 4 months old, is kind of going to be the general basis for these guys. Before doing the feline leukemia vaccine, it is also smart to making sure they don't already have that virus that they could have gotten from mom. So it is something that they can be transmitted from their mom, either in utero, so before they're born, or right after they're born too. So we do a small little blood test on them. It only takes like 10 or 12 minutes or so. We only need a couple drops of blood. We get that test done. We're making sure they're negative. Then we start their vaccines for it. What about another question? What about fleas and ticks? We always think about fleas and ticks, and another one is heartworm disease. So heartworm disease, if you watch some of our other videos, is a little bit different in cats than dogs, but we still can get heartworm disease in cats, so we like to protect them against it. So a common product that we'll use is called Revolution, or Revolution Plus. That can be started right at that 6 to 8 weeks of age. It's just a little topical between their shoulder blades on their back, and that's going to protect them against fleas, some ticks, and heartworm prevention, and also be pretty good for intestinal parasites and even ear mites as well. So I really like using that product for those. How do you know your kitten is a healthy kitten? So you get them, maybe you just bought them from a friend or something too, and you've never had a kitten before. It's a couple little things you can be looking at home. One of the biggest thing is just checking out how they're acting. Are they acting like a normal kind of crazy, like I mentioned before, kitten that's just running around through most of the day? They love to play hard and they love to sleep hard. So making sure they're being very playful, they're being energetic, make sure they have a good appetite while you're making sure they're eating well. You can also get a small scale and keep an eye on their weight and making sure they're gaining weight kind of day by day or week by week would be a good sign of making sure that they're growing as well as they're supposed to. You can also look at their kind of stool. So they're using the litter box. Well, is it a normal looking stool where you can see a little nugget, or are they having some diarrhea or loose stools? If they were having some really loose stools, that may be something you would want to bring them for the vet for. You can also check how they're breathing. So some cats, kittens will get some upper respiratory type of infection, just like we can sometimes. So if they have a whole lot of snot, maybe see some drainage from the nose or some crusting around the eyes, things like that might be a little bit of a warning sign of, like, hey, something's going on. Maybe I should bring them to the vet and get them checked out. So we can do all of your vaccines, the wellness, the preventative care types of things. If they were acting kind of really sick, we may recommend seeing a full service clinic where they might be able to address some of those issues a little bit better too for you. But we will do everything we can, making sure we get a good plan for your little kitten. And again, congratulations on the new addition to your family, and I hope it's a great one. If you have any other questions, check out our website, carolinavaluepetcare.com. You can take a look at our clinic schedule, and everything is on there as well. All right, thank you.